Thank you. Thank you. So I'm here from New Hampshire, and I'll just tell you a little bit about our small state of New Hampshire. We've got a population of about 1.3 million. The state runs about 180 miles north to south and about 90 miles east to west. And there are no roads running from east to west. You have to go north and south to get east and west. So it's a small state with a lot of geographic challenges to it. We have the lower tier is more populously dense than the northern and western parts of the state, which are more rural. And we have a high social capital index, meaning that people engage in relatively high level of civic involvement. But we are the live free or die state, or as some people call it, the live free and die state. We have no income tax, we have no sales tax, so we really have no tax base, which translates into little public health infrastructure. We have no local health departments, we have 2 municipal health departments, and we have our state health department. So most of the public health services that happen in New Hampshire happen as a result of community-based organizations. So that has, and we also have a high rate of youth alcohol misuse. So I work at the Community Health Institute, which is New Hampshire's public health institute, and we're working with the Bureau of Drug and Alcohol Services at the state, which started in 2007 through a SAMHSA-funded initiative, the Strategic Prevention Framework, to address the issue of youth alcohol misuse in the state. And one of the things that the state did is mapped out 10 regions across the state, and they contracted with a regional network coordinator, one person within each region, whose job it is to pull together a community base to develop a regional network for substance abuse prevention in the region. So that person is basically charged with convening and activating a group that we identified. The state is looking for a 5-sector model that includes education, safety, government, health care, and business, because those are the high sectors that are strongly impacted by substance abuse. And so we hope that they would have a strong incentive to also be involved in prevention. So the regional network coordinators have been working since 2007, have started to really gain some traction, and this year they're working on creating a community strategic plan that includes input from these sectors in the process. And so what we needed to do was be able to measure the level of collaboration across the sectors and within the regions. And so I turned to my partner, Danielle, for some help to get us going.
So when Lee came to me to talk about this stuff, I was in the middle of a project where I was working with a lot of public health practitioners to try to think of ways to bring measurement and to collaboration in the work that they were doing. And her story sounded really familiar. At that time, we had done a bunch of interviews with public health practitioners to ask them, what are you doing to demonstrate collaboration and to measure it? And they started telling us things like they were predominantly counting noses, someone said to me once, which meant they were showing lists to their funders and stakeholders and other partners of their partnerships. And what that made me realize, I'm a network scientist, and I thought, well, geez, that's really difficult to work that way, because all it does is it requires that we have more partnerships to demonstrate that we're doing something well. So I said, well, this is a place where network science and social network analysis could really help. So we applied for and got funding from the Robert Wood Johnson Foundation to build a tool to help practitioners like Lee do this kind of work. And The tool is called Partner. We spent a few years, when I first met Lea, we were in the midst of clunky development, and she was so patient and actually is almost on her third project with Partner. I think today she's speaking about her second one. And it was feedback like hers and other practitioners that really helped us create this tool. It was really important to us that the end user give us the feedback, tell us what was working and what wasn't working, because a tool that doesn't work in practice wasn't going to make much sense. So we ended up building this tool to improve the capacity, increase the capacity of practitioners to do social network analysis without having to hire an analyst. We know people don't really have money for it. They don't need to become a network analyst. So we created something that we could offer for free, that we hoped was sustainable over time, and also that folks could use relatively easily. And there is some learning that needs to happen. So that tool is called Partner, and it stands for the Program to Analyze, Record, and Track Networks to Enhance Relationships. You can find it at partnertool.net. Right now we have 500 or so, I think, people registered, lots of completions of the partner survey. What we ended up doing was creating a validated survey, a tool that works like SurveyMonkey, so people can administer a survey to members of their collaboratives. The data comes in, they just upload it into this tool. They don't have to learn how to use the data, clean the data, and there's an analysis option ready for them. And so with that and a really supportive team, we've had also created a lot of technical assistance for practitioners. So we have templates for dissemination, and we work with a lot of practitioners to help them figure out what to do with this data once they get it, how to put it into practice and use it for quality improvement processes. So it's been a pleasure working with Lea, and thanks to users like her, it's become something that I would actually say is a little more sophisticated today than it was when she started using it. So.
That's true. It has come a long way. So what we did is last September, we sent surveys out to the partners within each region that were identified by the regional network coordinators. And we sent 10 different surveys, and we sent them to 489 different organizations, partner organizations. And you can see from the numbers up here in the top table that there was quite a range. Some regions, they ranged from 23 surveys, another region sent out 72. We had a low response rate, and I think that part of the reason for that was, just as Danielle was saying, that people have been measuring by lists how strong their collaboration is, and I think that a lot of people identified spread a very wide net. So we've got a strong range across in terms of the survey sent, the response rate, and even the trust scores for the survey. The graph shows one of the questions identifies operational definition for levels of collaborative activities that run along a continuum of from none to cooperative to coordinated to integrated, and the graph shows that there's quite a bit of variation there, so that we're working with very different, the regions are at very different levels of integration, very different levels of development. And the maps up in the corner show the pictures of how different the regions look from one another. So we've got an interesting job ahead of us in New Hampshire. We are actually going to be resurveying in September, and it's going to be very interesting based on the learnings from this first pass, what the partnerships look like within each one of these regions. And my hypothesis is that they'll be smaller, and that the trust rates will be higher, and that the response rates will be higher. So the state is using this information to evaluate capacity development and coalition effectiveness across the state in terms of increasing along that continuum of collaborative activities, and also increase in trust scores and some other measures. And we're working right now with the regional network coordinators and their interdisciplinary, intersectoral teams. We're gonna have 10 community driven strategic plans submitted to the state by the end of June. And we've also got a couple of, we're looking to identify what organizations might cross the boundaries between the different regions. That's the next step of this data that we're looking at. And we're using it. I just completed a very small survey for a drug-free community coalition in New Hampshire, and it's great. It's been a really useful tool, and the state is going to be using it for the next 3 years to measure progress in this coalition, developments of the coalition. Thank you.